Hi, everybody. My name is Kheira. So you said it correctly, Kheira. I am born and raised in Northern Virginia. My parents are both from Algeria, so I'm also Algerian. I'm a rising senior at Thomas Edison High School in Fairfax County Public Schools. For the longest time, I've always wanted to become a physician, specifically an OBGYN. But I guess like recently, these past 2 weeks, all of a sudden I wanted to become, just like with my love of like, data science and psychology and medicine, I found something that wrapped everything together. So I'm strongly interested in a career in biomedical engineering. And I guess three things that, that make up who I am. I'm very passionate about psychology, data science, and empowering other people, specifically when it comes to like, female empowerment, just because of like, my past experiences. And some extracurriculars I'm part of is I helped start a group called Lead Peace, and it's all about peace building and conflict resolution, finding speakers who can connect with our demographic and they share their stories and their lessons learned. I'm also a runner. I know somebody said they ran track. I do mid distance, so I run the 1,000, and I recently started running cross country. And I'm also, again, super passionate about mental health and raising awareness and like, destigmatizing mental illness and all of that. So I'll be sharing more about the work I've done in regards to like mental health and how that has affected and how COVID-19 has affected mental health. Excuse me. So I guess um, the main part of today is, how COVID-19 and its effect on mental health. So I guess like due to the pandemic, the country is other than the fact that we're facing a pandemic, like, physically, we're also suffering a mental health crisis, just due to like the isolation and the fear, and also like the impacts of like restriction and uncertainty that is leading the American population and in general, like internationally, into widespread, psychological trauma and just like, depression and anxiety. I mean, think about it. I know for me personally, I was, I'm a very like social person. I love giving hugs. I love seeing people and just like, having like this unprecedented, pandemic all of a sudden, drop on us, it really affected my mental health negatively. But I guess I was able to like, with the help of some resources, kind of find my way up. But, another, interesting thing is like, according to the Census Bureau, is that more than 1/3 of Americans have displayed clinical signs of anxiety, depression, or both since the pandemic. And, 1/3 of like the American population, that is significantly huge. And prior to the pandemic, it was 1 in every 5 young adults or, adults in general. So just seeing that boost, and we can also see how like, there are many like, online therapies, counselors, and, lots of resources. And here, for example, we can see like, a company called Talkspace, they reported a 65% jump in clients since mid-February. So 65%, so that's like more than half of, their normal population. And another main thing I really want to focus today on is like the youth-led action we can take part in, especially as, youth or, high school students in the United States. The first thing is Our Minds Matter. And as a leader for a few years, with all honesty, if it weren't for Our Minds Matter, I would never have, come across like mental health or mental illness, I guess, in the society that I'm brought up into, just in general, the culture I'm emerge into, is that whenever we think about mental health, is that we immediately tend to stigmatize it with mental illness when that is not the reality. So basically, mental health, Our Minds Matter is a student-led club that strives to create a school environment that encourages open discussion of mental health, individual empowerment, use of appropriate mental health resources, and positive coping strategies. And the good thing is, if you're a student in high school, or even if you're part of any community and you want to start a club in your own respective school or community, all you have to do is reach out to them and they will provide you with all of the resources you need. So they'll mail you like art supplies, anything you need. And if you go on their website, they have like different meeting templates, how to approach different people. They have a handbook. So it's very well developed. So I will share the link and the social media to that a little bit later on. And then another organization, this is kind of much more related to like, the data science and like the scientific approach, is Promote Care, Prevent Harm. And their organization started in response to a Virginia Tech shooting in 2007. And basically they're all about, youth-led movement that's focused on like youth empowerment, young adults and communities to use promotion, prevention, science to promote care and prevent harm. And this past summer, I had, an honor. I was very lucky to be able to join a fellowship with Promote Care, Prevent Harm, and it's called Safety Corps. So basically, it's a 4-week fellowship where you get to learn. So whenever we think about psychology and mental health, it's always from like a liberal perspective, where it's all about, like just like you're reading articles, you're getting like takeaways from different people. But with Safety Corps, they tend to take a more data-driven scientific approach. So we learn about different concepts, perspectives, and the good thing is that you're in a group placed with people nationally, so people from different states. So you get different perspectives. And I guess one main takeaway that I want to share with you all that relates to like, global health is that, normally if you look at the first two parts of like equality and equity, with all honesty, that was the way I learned like the differences between equality and equity, is that, for equity, you can see like the different lengths of the stools, and there's like a wooden like, a wooden fence to show a game. Normally it was like a baseball game or like a soccer game or a football game. But I guess something that one big major takeaway from Safety Corps was learning how, science and how like data science can, influence people to move towards justice, where, if you can see like for the justice side, there's no benches, and the fence is see-through. So you could be short, you can be tall, anyone has the opportunity to, look at the game. And then something else, another flaw that, we came to conclusion as, we were discussing this in our fellowship, is that, that soccer game is only an instant gratification. It's only a one-term temporary effect. Like you can only see the game once. It's not, going to be long lasting and forever. But I guess with justice, you don't need a bench. Obviously one time, like over time, like overuse, the bench will break, or, resources will run out. And we can see how that relates to COVID-19, how, I guess with America, where our resources are running out. And before, what we should have done is taken a preventative mindset and focused more on like, the justice aspect. So I guess like, to wrap this up, like, with COVID-19 and like, as like a global health crisis, it really shows how our nation, or just like our mindsets in humans in general, we have never been geared to focus more on like, the justice aspect. It's always all about like equality, only about that certain moment. So that was one key takeaway that, I came out of with the Safety Corps. And they also equip you with all of like, the sciences and the stats and like the different effects COVID-19 has on the American population. And with that, you can create your own social media campaign based on what you're passionate about. And as I mentioned before, I'm greatly passionate about mental health and raising awareness on that. So that's what my social media campaign is focused on. And then to wrap this presentation up, I just want to share like a few main, personal takeaways that I've learned in general when it comes to like, mental health. Is number one is to just know who you are and know what your why is. And especially that, we're focusing about mental health in the time of like a pandemic. It's very vital that you take time to take care of yourself. Because if, let's say, like, think about it like a battery, you can't give 100% to someone else if you're not fully charged. So with that, you have to set boundaries and, know what, when it's a no and when it's a yes. And again, just take the risk. And lastly, collaborate. There are so many different organizations and nonprofits out there. So it's much easier to just like work together with someone else than starting something on your own. So I would greatly recommend collaborating with other people. And, these are my resources that I referenced. And for acknowledgements, I am very grateful for, you know, the leadership board here at Johns Hopkins and for everyone here watching for like giving me this opportunity to share my resources that I have about mental health that have personally helped me in the pandemic. And hopefully this can inspire someone else or help someone else who's going through a hard time. And again, if you have any questions about Our Minds Matter or the Safety Corps program with Promote Care, Prevent Harm, please don't hesitate to email me, or you can follow me on Instagram and DM me there. And I would greatly recommend checking out the Safety Corps Instagram. So the cohort number 2 will start in about 2 weeks. So if you're interested, apply, and also you can screenshot the QR code, and it has more information about what Safety Corps does and all about like how to apply and like the mission statement and all of that. So I strongly recommend you check that out. And again, I'm looking forward to any questions or comments that you have. Thank you.